yeah, feel free to start. Thank you.
Yeah, thank you so much. I'm really excited to be here. When I was invited, like I freaked out a little bit, but just the process of having to do this has been super helpful for me. I want to start with a little disclaimer. So I'm currently an officer in the U.S. Army. I'm a child and adolescent psychiatry fellow at Walter Reed National Military Medical Center, but I'm here as an individual. Everything here is my own opinion and no one else's. Also, many of the images in this presentation are AI generated, just for people's knowledge. Just to introduce myself a little bit, so I was raised a young Earth creationist. I really tried to take that ideology to its logical conclusion, and it didn't work out very well for me. And also during my childhood, we navigated through some years where my parents were kind of in and out of some mental health institutions, and so there's a lot of, you say, uncertainty. And so I kind of became disillusioned. I had tried college first, but didn't really have passion. So you could say I ran away, became kind of a intermittently undomiciled 90s hippie. Think like lives in a van down by the river. And that was pretty accurate. But while I was doing that, I was going to the library a lot, and I discovered books about like naturalism, natural philosophy, scientific reasoning, human history, etc. And I really realized I didn't know much, and it was very inspiring to have all of this perspective knowledge. And so I decided to go back to university, and there I achieved a bachelor and a master's degree in biodiversity, ecology, and evolutionary biology. And then through an odd set of circumstances, I ended up joining the U.S. Army as a medic. And then after that, I went to medical school, and then I discovered psychiatry, which was the last thing on my radar. And here I am. When I was in residency, I had started the first of two kind of educational podcasts I do to help me learn my craft better, because if I have a project to do, then I learn much better. And I was introduced to attractor networks by one of my supervisors, Dr. Hendrada. And that's what got me interested in active inference, because reading about attractor networks, I had to follow some breadcrumbs, and that's how I got here. So I got really excited about the idea of the Bayesian brain, and tried to do, or I did, is my senior grand rounds presentation on it. And the response from the crowd, I think they were a little overwhelmed by it. These are not ideas that we had talked about a lot, and so there wasn't much feedback. And then in the future, some of the responses I've gotten when trying to talk about neuroscience is, well, maybe you should talk about this less. But the most important feedback I've got has been the question, well, how is that relevant to what we're talking about? And so that's what I really want to make this presentation about. So first, to determine whether or not I really understand active inference, and also then hopefully my long-term goal is to develop like a relatable method to explain it to my colleagues, but also to people in general. And one of the problems in psychiatry is we have tons of models about things, and you could say like, what is depression? Well, there's a lot of models for that. So Freud might say something like it's anger or aggression turned inward. If one of his students, Carl Jung, who went off on his own, would say, oh no, it's the depleted ego's experience of itself. And then you might have more cognitive scientists like Beck arguing that we have these like self-defeating schema and distorted beliefs, and that's what causes depression. And then you might have other thinkers like object relations who say, oh, depression is actually, it's like you lost something, but it wasn't a real loss. It's just a loss in fantasy. And that creates this intrapsychic conflict. And I'm sort of a fan of the idea that really all models are wrong, but some models are useful. And the difficulty with concepts like these is that they're often very metaphorical, which can be helpful, but they're also difficult to test, and then become kind of increasingly parameterized over time to try to justify all of the little ways in which they don't quite work out, and they're not as helpful to help us think about neurobiological mechanisms, but they're really helpful for us to guide our narratives about ourselves and our patients. So what I want to try to do is attempt to explain the relationship of active inference to psychiatry by first providing an accurate yet accessible explanation of what it is, and then trace the confluence of some psychological paradigms toward ideas that are consilient with active inference from the last century, and then explore a little bit where and why active inference framework might apply in psychiatric clinical practice. So first, kind of trying to provide an accurate and accessible explanation of it. I think it's helpful to start like contrasting it to something else. So the traditional way that the brain was kind of explained to me is passive inference. So we're born with some models, we develop other models over time based on our experience. But when we have a perception or a thought, then we call up a model, we try to figure out what it is, and then we decide what it means, and then we decide what to do about it. And it's all a very kind of wait and see, passive and inefficient process. So there is a much more efficient way to explain how the brain works. And we don't wait to have a perception. Instead, we predict what perceptions we're going to have, what sensory data is going to be. And we do that based on the context, the prediction of the causes of those perceptions. And then we compare the sensory data after we've already had basically a perception to that prediction. And if it matches well enough, well, then we are satisfied, we continue on to predict what will come next. But if it doesn't match, that's when the brain needs to do more work. And then it would be best to either like modify or switch our model or change the world to match that model. I'm going to talk about those two things in more detail. But first, I want to, I think this is one of the most compelling demonstrations of active inference, and it's called the rubber arm illusion. It's been done many times in scientific experiments, but this is Justin Willem. He's actually a magician, and they're masters of active inference. It shows how we can use visual information, but it's interpreted by the body as tactile, temperature, or pain information. So let me know.
I placed an ad online inviting participants to take part in an experiment. We try a little experiment?
Okay.
Yeah, I'm going to make these people believe that this fake rubber prop is actually their real arm.
Seems unlikely.
This is a Fibonacci silk, but let me show you how it works. If I drape it like this, the gap is now gone between your shoulder and the rubber arm, and your brain kind of fills in the gap. It's called the Seinfeldian effect. Simultaneously, because you cannot see your real left arm, your brain disassociates that. That's called the Costanza effect. I'm going to attempt to establish a connection right now using these. I'm just going to rub the feather along the fake arm and your real arm that you cannot see. Your brain starts to connect the fake arm sensations and make them real. Now let's see how strong this connection is. Do you feel this?
Yes.
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 And that?
Yes.
And this?
That's cool.
Isn't that wild?
Yeah, it's very, because your hand is,
Yeah.
that's
The
weird.
brain
Yeah,
connects them.
that's interesting.
Let's just test how far that connection goes.
Okay.
The cold test. Now, on your right hand, do you feel that?
I do.
Cold.
Yes.
That's why I call it the cold test.
Genius.
When I place it over here, how does that feel?
Cold.
Now, what do you feel?
Nothing.
You don't feel an ice cube resting on top of your hand?
No.
Let's try another experiment. I call this one the heat test. I'll be very gentle. I promise not to burn you.
Okay.
Just curious if you feel that. What did you feel?
A little bit of heat.
Tell me how this feels.
Ah.
The pain test.
I'm going to go ahead and skip forward a little bit.
Oh! Oh!
This is, I think, a really great demonstration of active inference, where we're predicting what will happen and then really acting to make those predictions real, even internally. And I think this is what people refer to when they say like self-evidencing. So this more efficient way to explain the brain says that we have these cognitive models and we predict what we will experience, and then we try to make sense of what we have already experienced after the fact. But an efficient model only needs to do the second part if the first part has failed. So it doesn't have to always attend to all the sensory information if its predictions are matching what's coming in. But sometimes our models can be surprised. So that's when data is not matching our prediction. And then we have to do something about that. So surprise is related mathematically to an idea called variational free energy, which is basically the difference between predicted data based on what we have inferred the cause of that data to be, and the sensory data distribution. And so you can think of this also as prediction error, where our model doesn't match the data. And so in a more generalized term, there's an idea called the free energy principle that everyone here, I'm talking to right now is familiar with. But it basically states that for any self-organizing system to persist, it must, on average, reduce surprise. So it has to reduce variational free energy, has to reduce prediction errors over time. And but the problem with the world is that the world changes too. So because our environments change, models that persist have to be flexible, and they have to tolerate at some increase in surprise sometimes, kind of in order to find a more adaptive state. To gain more information, there has to be some sort of tolerance of, you could say, uncertainty. And then psychopathologies can result if our brains become, for example, too avoidant of surprise. And anhedonia can be maybe an example of this, or have too high an expectation of information gain. And mania could be an example of this, and I'll go into those in more detail. But first, having the model is not enough. The model needs action. It needs to act on the world. So when a model is surprised, it can be reduced. The surprise can be reduced in two ways. So you can either change that model to fit the data, or you can change the data to fit the model. Now the first one, I think, and I'm not quite sure, but this is kind of a question, is probably more optimal in data poor environments where there's not a lot of expectation of having more data to fit the model to. Or that you can fit to the model. And instead, but if you have a world where you have this data-rich environment, then you could find data that will fit the model. So changing the data to fit the model might be more optimal in a data-rich environment where there's more expectation of information gain from the environment. And to change the data to fit the model, we can do two things, or more than two things, but here are two basic things, which is to change the world, so that makes the world match the model, or to change how we sample the world. And so we could say maybe filter out noise or ignore data, and I'll get into that a little bit more. But first I want to talk about how some psychological paradigms in the last century kind of got together and created a therapy that's really consilient with active inference ideas. And so there was this marriage of extremes between the cognitive theorists and behaviorists who really did not like each other that much. And thought they could do without the other for a long time. So just by way of review for anyone who's not familiar, behaviorists, these are the scientists who thought that, like, all we have to do to know what's going on is measure human behavior. That's the only thing we can see. We're not that interested in what's going on inside the head. And then they came up with these ideas that have persisted, called classical conditioning and operant conditioning. So classical conditioning is you probably have heard of, where this is the Pavlovian, you bring food to a dog, you ring a bell. And if you continue to ring the bell every time you bring food to the dog is going to react as if the bell is food in the future. So the bell starts out as a neutral stimulus, and then it becomes a conditioned stimulus, and it causes the dog to salivate because the dog expects food when the bell is ringing. And that's classical. That's the classical example of classical conditioning. But then there's operant conditioning, which is basically whether or not a behavior can be increased or decreased. We don't know what's going on in the black box, but we do know that there are some things that are innately rewarding and punishing. So that's useful for learning, and you can make someone better at something by giving them rewards, or not do something by punishing them. But these two types of conditioning really aren't separate things that operate separately. They're really kind of going on at the same time, where you can associate anything with a reward or a punishment at the same time that you're giving the reward or punishment, and do operant and classical conditioning. And so for behaviorists, this is how the world works. We don't need to know what's going on in the black box. We can do everything with this amount of information. But the cognitive theorists really super interested in what's going on inside that black box. So they think of things like, well, we have thoughts, right? Those are important, but these thoughts arise from different operations. You could call these things like beliefs or assumptions or attitudes. But those are all guided by structures inside of our mind, which are often called schema. And it's those things that determine our behaviors. So thoughts aren't just a byproduct of our emotions or behaviors, but rather they drive them. And how we're biased by those schema determines how we feel and how we act in the world. So for example, classic examples of schema are like, I am unlovable. People can't love me. So an intermediate belief about that schema is that if I offend one of my friends, they will abandon me. And then you encounter a situation where a friend cancels some plans. So the automatic thought there is, well, obviously they don't care about me. That's accompanied by sadness and anger. And the behavior that is consistent with that is to withdraw from that friend. And that basically confirms that the friend abandoned you and that you are unlovable. We can have nice schema too, like I'm competent, but those people usually don't end up in the clinical setting as much. So as clinicians, we focus on these maladaptive schema. But this hierarchy of things is very similar to kind of a generative model. And I think Carl in 2013 in neuropsychoanalysis put it like this. The brain infers the hidden causes of sensory input in terms of posterior expectations or predictions about the hidden states and causes at each level of a hierarchy. So we have a hierarchy, sort of a top-down generation of information, and the cognitive thinkers think that's the most important thing. And then we have the behaviorists, which are like, no, really, it's the bottom-up stuff. You're just making this other stuff up. You don't really know what's going on inside. The only thing we can know is the behavior and these very simple responses to these reinforcements and associations. But putting them together actually makes something very similar to active inference. So we do, one of the most effective therapies implemented in the modern world is cognitive behavioral therapy. And there are tons of different types of therapy that are just kind of offshoots of these ideas. But as a basic idea for cognitive behavioral therapy, we assume there are thoughts, beliefs, attitudes, and affects. And these are determined by kind of cognitive structures like your schema, or they're also called core beliefs. And those can be updated either by hypothetical thinking or by contrary action. So a CBT therapist will ask a patient to think or act in a way that's contrary to what they currently think or feel, as a way to discover that their expectations are not substantiated. To give that a little bit more technical language, as someone more familiar with active inference might put it, in order to satisfy an expectation of information gain, patients are required to think in ways or act in ways that temporarily increase their surprise, their variational free energy, by imagining or exploring possibilities that their schema would not otherwise permit. And this creates a flood of feedback, which are prediction errors, and that results in the updating of beliefs that affects thoughts and behaviors. Another way that it's becoming more and more, I think, active inference ideas are becoming more important for clinical practice is in how we conceptualize different behaviors. So this is a really busy slide, but I just want to point out at the top here is basically a generative model. So what that means is that you're generating probabilities that certain types of beliefs will about the world will result in certain things. Certain ways in which you could interact with the world will result in certain outcomes. But I want to focus here on the very bottom. So here on the dependent behaviors on the bottom left, kind of draw your attention there and go backwards. So we're starting with these dependent behaviors. If you follow the lines back from them, it's not actually one thing that results in dependent behaviors. It's multiple different beliefs about the world interacting that could result in the high probability of engaging in dependent behaviors. So you could have very vague expectations about the world on an outset. So you assign, say, equal or low probabilities to both negative and positive future states, social states in general. And then when you observe other social states, you have low confidence in your observations. So you can assign equal and low probabilities for inferring negative or positive social states from your observations. And that's going to contribute to dependent behaviors. But then to kind of seal the deal, you have these high efficacy expectations for dysfunctional action sequences. So that what that means is you assign high probabilities to transforming negative social states into positive states through dysfunctional action. And for a dependent person, Dysfunctional action would be like excessive reassurance seeking or having someone else make their decisions for them. And so it's not one thing that creates dependent behaviors, but a whole bunch of different expectations together, where these same like vague expectations might contribute to passive behaviors, and these same dysfunctional beliefs might result in hostile behaviors. But when they're interacting with other models, that's where you get behaviors. And then just to make this even more of active inference, these same behaviors feed back to the model itself and tell it information that it can use to adjust its expectations. So that gets us to the question about like really how are these models formed and then kind of reformed? What do you have to do to have that happen? And the first thing is that a model, well, by definition, basically is a prediction. So it predicts the environment or itself. And so it can kind of be seen as an error waiting to happen. It's sort of a place to start. It's like a prior. And the only thing a model can predict is like the thing next to, the thing that it has access to. So for example, in the brain, we have different parts of the brain, and these different parts can only predict what information is going to come from the parts that it's communicating with. It doesn't care about the outside world so much as it cares about predicting the thing closest to it that it can talk to. So we think of the brain as sort of passing this information up and then back down again, but it's really far more complicated than that, of course. So we have all these loops inside the brain where these self-checking mechanisms are going on, and errors are being generated. And when we get information from the outside world, it travels to these different places via different routes, and these routes are important. Like for smell, it's straight to the cortex. So this information isn't getting processed through, for example, the thalamus, where the retina first sends its information. So and it's not getting processed through the brain. The retina is not getting processed directly through the brainstem when it first comes in. It goes to the thalamus first. So these parts are each predicting what's going to happen based on what it's getting from the thing beside it, but not what that thing is responding to necessarily. And then it gets really complicated. And I just want to point out that 80% of all the neurons in our brain are in the cerebellum, and it's probably one of the most understudied organs in the central nervous system. And it seems that it really is helping with a lot of precision in our predictions. But I don't have time to get into that. But to make a prediction, we have to have some sort of separation between ourselves and the world. Like, what is the world and what is us? And so the concept that is used for that is called a Markov blanket, and it's the thing that separates us or our thing from the rest of the world. And this allows for an exchange of information in a way that can be modeled. If we were completely separate from the rest of the world, then it wouldn't matter. We wouldn't be able to make predictions about it. So the self has to be leaky. It has to let stuff in and let stuff out. And then these selves can be nested within hierarchies. So you can have a small self within a larger self in the same way that kind of the brain is structured. So because you have this hierarchical organization of a bunch of selves, these things can be modeled as small world networks. So basically a small world network is just a network in which every node in that network can be connected to any other node by only a few steps. So you can get from one side of the network to the other side very quickly. And but first you have to know kind of what a node is. So you can think of a node as a self. So it's an integrated unit that brings in information and sends out information, and it has its own Markov blanket around it. And then within the system there are hubs, and hubs are basically just nodes that are really highly connected, or a bunch of nodes that have their own extended Markov blanket around them. So you can think of a hub as a larger self that's highly connected, and you have to have hubs to have the small world network because they're so highly connected. You get to a hub, and then you can get to another place very efficiently. In the brain, for example, if you're trying to go from one neuron to the next, to the next, to the next, it would take forever to get somewhere. So you need to go from nodes to hubs. And we know that within the brain, we can measure activity on a very kind of high level, but we've identified that there are definitely hubs in the brain that act like this. And without going into too much detail, we've named some of these things like the central executive, parts of the central executive network, part of our default mode network, things that help us with salience, with memory, visual information, and then things that coordinate all of that, like the thalamus and the striatum, all have identifiable hubs within them. And another extremely important thing about these small world networks is that they have scale-free properties. And at first that sounds like it, though they can't scale up, but what it means is actually they can, and you can model each level similarly to the way you modeled the next. So you can look at these like cells within these little neuronal networks, and then you can look at these local networks of these little neuronal networks, and you can model those basically the same way as you modeled the smaller networks. And then you can look at whole brain regions and networks and interpersonal interactions between humans, and you can model those in a very similar way that you can model the smaller networks. And then you can draw like a little Markov blanket around those and have things like institutions or societies or cultures, and you can model these often in a very similar way that you can model the very small things. Now, as you get higher, you have these emergent things that happen. For example, like human language can't exist at this small level. It can't exist at the neuronal level. It requires social interaction. So you do have emergent phenomenon. It's not like there's no difference between these, but the way you can model the interactions between these things is very similar. And that's because when you put something into a network and then the network puts something out, there's usually a loss of information. So the local information that was in that network is lost because the output is integrated. And so what you hope happens is that the network receives real signals into it, and then it processes those and it sends out what it thinks is the best response to that. And that would be a true positive because you got a real signal in and you sent a signal out. But sometimes you get real information in and no signal is sent out of the network. And so you could call this a false negative because information should have been sent, but it wasn't. So that's a loss of information, complete loss of information, whereas a true positive is just a relative loss of information. And so this gain especially this loss of information is really important. If you just wiggle your toe or move your leg, in order to do that, to think about that and then accomplish it, you may have required thousands, millions of neurons, but the in transmission is integrated into very, very simple output that can be modeled very simply, much more simply than all of the inputs that had to go into it. Not only though is there loss of information, there can be a gain of information. So we could call this misinformation or disinformation. And this is because you have either false or kind of random signals sent, or sent to the wrong place or misinterpreted. So you have this could be called things like illusions or hallucinations. We'll talk about a little bit more. So there's always noise outside the system and noise within the system. And the system is supposed to be able to know what's noise and what's not, and not send a signal. It's supposed to have a true negative, I'm not sending a signal, but sometimes it does anyway. And so we could call that a false positive sent, where there's no real information coming in, but there's an interpretation of real information on a downstream network because a false positive was sent. And so at every level, we get information and there's some sort of prediction of the cause of that information. That's whatever is relevant to that level. So before we sense anything, we've basically already predicted if we will be sensing anything, if there's anything out there, and what it will be or what it could be. And perception is not really a response to sensation. It's a prediction of sensation. And these predictions are bound into things that can be described as attractor states or attractor networks. And so what are attractor networks? I think of attractor networks for myself because it helps me to conceptualize it, and that might be wrong. But I think of them as things that prevent random processes from just diffusing information so much we couldn't possibly actually know anything. So it's kind of like gravity for certain kinds of information. So an attractor, certain kinds of information is available. It goes toward that attractor if it's in the vicinity. But maybe a more technical definition comes from people who study this more than I do. And they say like attractor networks are characterized by more or less pronounced attractor states. So these can be low energy states, and these are states toward which networks tend to converge by default. And so it can be said that attractor networks are things that move toward stable states. And these states are either low energy, where the network is kind of maintained, and there's really not a lot going on here. You could call it like a belief state. And then there's high energy states when energy is suddenly added to a network in the brain. You could say like glutamate release in a certain area, and then that network becomes highly active and robust and excitatory, or it's sending out inhibitory signaling, but it's signaling instead of just hanging out in its basic belief state. So one way to visualize this is to think of these things as basins, where you have this low energy state. It's just kind of there. It's crystallized, and then there's some activation energy, either a sensation or prediction error coming in, and that provides energy to the system. And so the system gets into a state in which it's starting to now pass information. So it's excited. So it's integrating and passing information forward, and that's the high energy basin state. But then it needs to get out of that high energy state, because if it doesn't, that's a problem. So there's some active inhibition that pushes it back down into the low energy state in order for it to get back to where it was before, and waiting for new information to come in. And so these energies that change the states from active to inactive can be seen as like built-in Bayesian priors that a signal is real or important. So you have to get enough signal to change the state. You have to get enough energy put into the system to change the state. And that level of energy can be seen as like a prior probability that something is kind of real or important. So this prior then is going to determine the rates of false positives and false negative signals that these attractor states are going to be engaged in. So is it sending information when it shouldn't? Is it not sending information when it should be? So I'll get back to that in a second. We could also think about this in terms of kind of entropy. So if data matches our model, then our attractors are unperturbed. They stay in this sort of, the low energy basin can be seen as a low entropy basin as well. It's highly ordered state. And so there's really no new information available in an extremely highly ordered state. There's no surprise happening. But if there is surprise, then a prediction error is generated, and so you could say you're in a higher entropy state. There are more possibilities here. There's uncertainty, and so that surprise generates prediction errors, and this error causes us to explore different possible predictions. And so in order to do that, we have to explore a higher dimensional space with more possibilities. And then once we've done that process, we have to repeat that process over and over and over and over again, kind of exploring whatever space is available until like the system's either satisfied somehow, so they change the data to reduce surprise, or change the model to fit the data, or the system just becomes exhausted, which we hope doesn't happen. And I think people intuitively know how you could change your model to fit the data. But I think it's a lot harder for people to intuitively know that you can change the data to fit your model. How would you do that, and why would you do that? But there's multiple ways to do that. One is to look for a signal within current data that just confirms a model. So you have data available, and there's noise in that data. So what you have to do is place your attention only on the most relevant data, and that's a process called salience. And you do this in order to get data, and so you're not overwhelmed with too much data. But you can also almost intentionally get data out. If there's enough data, you can do something called cherry picking, which is, I think, kind of falsely reducing surprise, but it feels like you are, where there's enough data there that you ignore the parts that disagree with your model and just grab the parts that agree with your model. And that results in no model updating when models should be updated. You can also just change the source of the data that you're looking for, and that changes the data itself. So you could just look somewhere else. Imagine a moth is flying around searching for a flower, and it gets to a flower. It doesn't match the model, so it turns another direction until it finds that. So it looks somewhere else. Another thing you can do is change just the mode of perception. So I think in the previous video, people were using vision instead of like pain or temperature reception and still feeling it, but you can use vision instead of proprioceptive fibers to locate yourself in space, and that can be very helpful. But another thing we can do is invent data. So data can just come out of, I guess, nowhere. It's kind of unreal, not bounded to the world data. So it's imagined. And so things like false memories, confabulations, delusions, or hallucinations can arise from all this false you could say false positive invented data. Another way then, it's kind of like inventing data, is to add a parameter to the model that seems to explain to you. And you could think of this, an example of this would be like self-justifying to reduce your cognitive dissonance. For example, you did something like you were mean to someone and you're like, I'm not a mean person, but then you start to justify it, be like, well, I had an excuse to do that, and so that makes me not a mean person. So you add this parameter of the excuse that you got, and that is an invention of data in order to justify something. But another thing we could do, and I think this is super important for pathology, is avoid data. And avoiding data could be because of an inability to consider the data, or maybe a refusal. So like intentionally moving away from the data source, and because that has potential information gain in it. And so this is a big problem for, I think, active inference, just thinking about it in terms of if you're reducing surprise, if you're reducing free energy, you can do that by moving somewhere where there's just less and less data available. And so you're not surprised because you're not getting data unless your model predicts data. So you can move into a dark room. And to get inside this place where there's less, it's very, very highly structured, low entropy state, it could require a substantial amount of increase in free energy or to escape that state and find a more adaptive state within the landscape of possible states you could be in. So if you get stuck in a dark room, and to think about this in terms of some of the things psychiatrists and psychologists talk of, low entropy states like this might include things like anhedonia or chronic delusions, where those delusions are fixed false beliefs that can't change, as compared to different kinds we'll talk about, or agoraphobia, or avoidance behavior, separation anxiety. So in these states, there's kind of a unrealistically low expectation of information gain in the rest of the world. So you can maybe, and I'm not sure if this is true, so I'm asking, like, these can be seen as really highly precise states and yet inaccurate, because they're just missing the target. And then there you can think of like more high entropy states where you have these loose associations, kind of like impromptu delusions, manic symptoms, hallucinations, things like that. And these states have this, you could say, unrealistically high expectation of information gain. And for that reason, they're highly imprecise. And accuracy might just be impossible because they're so imprecise. But then you have states in which, entropy kind of fluxes between potentially highly imprecise and highly precise predictions, and that may or may not be accurate in conditions like PTSD or OCD. I think borderline personality disorder is kind of defined by instability of states and behaviors. So it could be that there's this fluctuating or conflicting expectation of information gain. And to try to make this more brain specific, talk about quickly some neural correlates of active inference, and we can start with psychosis because there's been a lot of good work about that. So we know that we can make a normal person psychotic simply by sensory depriving them. We can put them in the sensory deprivation room, and at some point that's going to produce some hallucinations in that person, or paranoia or something. And in patients who have delirium, one of the things that we prescribe to these patients, because their brains are already at a very fragile state, is to give them more sensory information to make sure they're getting that, because they will start to hallucinate very quickly. So the brain seems to expect things coming in, and if it doesn't get that, there is a lowering of the activation energy. You could say the prior probability that some signal that it's getting, internally generated or externally generated, is real. So smaller signals can get through, and so this lowers the threshold and increases the number of false positives. And so you get hallucinations even with no information, because the brain is trying to reduce the number of false negatives that it's predicting that it's getting right now. So that's one way to think about psychosis. And some of the ways that this can happen, you can think about it in terms of whether or not you're getting inhibitory or excitatory signaling in different parts of the brain. So GABA is an inhibitory neurotransmitter, and glutamate is excitatory, and it hits the NMDA receptors. But in the medial temporal lobe and parts of the prefrontal cortex in patients with psychotic disorders, there's often less NMDA signaling and so you have a less robust active state, and there's less GABA signaling, so it's easier to get into and stay in the active state. So what happens is you end up in this pathological state where, as it's described in this paper, it's a network with these characteristics will display loose and erratic jumps between these low frequency resting states and high frequency active states. So that helps to explain why you get these hallucinations, delusions, identity confusion, because you have unstable networks. In chronic psychosis as well, we know, for example, like in the dorsal striatum and also manic states, there's excess dopamine. So this could change the signal to noise ratio in favor of noise, false positives, because it's inhibiting the GABAergic collateral inhibition. So it's making it easy to get into the state. And it may or may not be hard to get out of the state. So if it's easy to get into an active state and that state well is deep, then you're going to be stuck there and potentially have a lot of disorganization of thought, maybe stuck in hedonic drive. But in psychotic disorders, we also know that in certain parts of the prefrontal cortex, there is deficient dopamine. And this might help to explain some of the negative symptoms of schizophrenia. Because if you have deficient dopamine, and dopamine tends to inhibit these inhibitors, then what you get is making it very difficult to get into an active state. And if you have concurrent reduced NMDA signaling, it's easy to fall out of that active state. And so this might help to explain things like avolition or affect flattening, or the kind of the cognitive rigidity where they just can't update models because it's hard for them to care, honestly. And we can't look inside people's brains and see these things happening. We can't know exactly what's going on inside their brains, and so, but we can look at things like eye movements. So some people have tracked eye movements in patients with schizophrenia and noted that their pursuits, which is how you follow something in space, and their saccades, which is kind of where your eyes dart to left and right or up and down where they need to go quickly, both of those are impaired. So this top picture is a patient trying to follow these curves with their eyes, and this is tracking their eye movement. So their eyes are the movements are very imprecise and often inaccurate. And also they can't stay fixed on a single point. It's very difficult for them to stay on that point. And if you introduce a little distractor dot, their eyes go to it, even if they're told don't. So they cannot resist the distractor. And so there's been modeling of this, looking at how you have this bottom up and top down control, and without getting too much into that, just pointing out that if you model this and you perturb one of the inhibitory signaling neurons, these parvalbumin neurons in this model, as soon as you perturb it, the model becomes, well, a little bit erratic. It overshoots and it's far less precise in its movements, which is similar to what happens in schizophrenia. And the same thing, if you perturb that neuron, you also in these models can't stay fixed. So there are ways to model this using eye movements that are consistent with these ideas of these unstable or too highly stable states. And so I want to move into thinking about this in terms of like attention, affect, and motivation instead of its psychosis. So there's a little boy standing under a tree, and the boy's deciding whether or not they want to climb the tree. So there's this risk reward kind of thing going on, and driven maybe by emotion or motivation. And if this boy is a migrant and just got there and is super thirsty and hungry and sees an apple, that's a different context than if the boy just walked out of his house after he ate a big dinner and he's kind of satiated and feeling good, looking up at the apple. So what's going to motivate him more to climb that tree? And so we have different levels of motivation in different types of pathologies. Like in anhedonic depression, there's super low motivation. There's a paucity of goal-oriented behaviors or pleasure-seeking behaviors. Even food can be devalued, and people won't eat, and they'll lose weight. And there's this kind of very low expectation of information gain potentially. But then we have mania, and it's associated with just excess goal-oriented behaviors, prioritization of pleasure, this hedonism, and also excess value attribution to things. You're going to sell me a beachfront property in Florida? Sure, here, have my bank account number. So there's very high expectation of information gain. And in both disorders, executive functions are impaired. So attention is impaired, concentration is impaired, and reasoning and sleep are impaired in both. So what's kind of happening here, if we take a quick run through the brain, is that visual information comes in, but it doesn't go straight to the visual, to the visual cortex. It stops in the thalamus, and it's really the thalamus is just talking to the visual cortex. And once it gets to the visual cortex, it gets split and kind of goes in a couple places, in a dorsal stream and a ventral stream. Now the ventral stream, this is where probabilities about its identity are calculated. So what is its probable identity? And then that information is fed forward to places like your orbital frontal cortex and your amygdala. In your amygdala, that's predicting the kind of, you could say, the affective value of this thing. And then it's sending that prediction to the hypothalamus, which is predicting the most likely appropriate autonomic and hormonal responses that need to happen right now, based on the context of what it thinks is going to happen. And then it ends up sending information also to autonomic brainstem nuclei, which either can increase or decrease the gain on the system, basically. So and the orbital frontal cortex can be seen as, or conceptualized kind of as an economist, where it's taking lots of different information, top-down information from like the prefrontal cortex, your current emotional information, and then other information that's kind of built into it, reinforcement values, whether or not you're hungry or satiated, value-based memories that it has stored. And it's integrating that information, and once it has predicted a value of that apple, then it sends that information forward to the anterior cingulate, but also to the dorsal striatum and back down to the brainstem nuclei. And that prediction of what kind of gain we need on the system is also being incorporated into the model. But then there's the information going through the dorsal stream. So the dorsal stream is the thing that kind of locates the apple. So the form, the location, the size, the distance from it. So these are kind of spatial predictions, and those are sent to the posterior cingulate. And in the posterior cingulate, it's of course talking to the memory centers and trying to figure out like what it can remember about these things to calculate probabilities of how it could, what the distance is most likely given the information that it has now. And then it sends information that forward into more of the mid-cingulate region. And that's where the ventral and dorsal streams seem to align. So once you get into this information here, then there's premotor cortex planning. So it starts to plan the most probable actions that are needed either to achieve the reward or to avoid some sort of punishment, or to do nothing if you don't want to do anything. And so here it's helping to calculate the predicted risk versus benefit based on all of those other predictions that are going on, and then facilitate action outcome learning. And so that could be like the updating of the priors in a situation similar to that in the future. What is the prior probability that these actions will result in what I want them to? But at some point, the orbital frontal cortex needs to become, you could say, satiated. It needs to return to its low energy state. And that way the action to gain the reward will cease, or the action to avoid the punishment will cease. And action outcome learning can update. But sometimes that doesn't happen too well. And so Edmund Rolls and colleagues have talked about how OCD might be seen as a problem of attractor states in the orbital frontal cortex. So in this case, the orbital frontal cortex really delays the cessation of the signals that it's sending. It kind of resists being satiated, you might say, and it stays in this high energy attractor state. So there's kind of continual effort to update this reward prediction, or this prediction of, often in OCD, it's like avoiding some sort of punishment or bad thing happening, and you need to do an action to do that. But you do the action, but you don't stop feeling as if that action has not happened or has been inadequate, and there's no updating. And so one of the ways this could be conceptualized is that you get stuck in a high energy well. So there's excess NMDA signaling, and you're in this excessively stable high energy state without enough active inhibition. And once you're up there, you can't get out, at least not as easily. And so if you compare that to, say, what I talked about with schizophrenia, if you have in schizophrenia, you may have avolition, not wanting to do things. So in the prefrontal cortex, deficient dopamine, resulting in increased GABA signaling might make it really hard to get into a motivated state. Or if the problem is in the more dorsal striatum and you have excess dopamine, then you might be in a highly unstable state. Instead of as in OCD, where the high energy state is very, very stable. So I don't have enough time to go into everything I want to talk about, but I could talk about some treatments if people have questions. But why does this matter for psychiatrists? The basic idea that in order to persist through time, a complex system must on average reduce surprise is not that surprising itself. I think it's consistent with things like natural selection, that you have to be able to predict the future. But we don't really think about patients like this as much as maybe we should. So organized networks at every level basically can behave as if they are engaging in active inference in order to reduce surprise. And so there are these scale-free properties in which we as individuals interacting with each other are in some ways not so different than neurons interacting with each other. And some psychopathologies really can be modeled as consistent failures to estimate realistic prior expectations, or erroneous updating of priors. And so there ends up being a problem with things like the accuracy and the precision of our models, and that results in what we can see in our behaviors. And then in the end, like, hypotheses about the mechanisms of these models updating really can guide neuroscientific, psychopharmacological, and psychological and clinical research and case formulation, whereas a lot of the other models that we have that are far more metaphorical, not necessarily wrong, but they are not as, I don't think, useful for guiding research or for guiding how we think, or how we should be thinking in the future about patients. So I think this is a really good place to pause for now, and see if anyone has questions or can maybe answer some of the questions I raised. I'm not sure if Miguel's connection is working very good, but I see.
Hi, I'm going to start. Miguel probably is still testing his microphone. I'm Patrice Ducat, psychiatrist, a psychotherapist from Michigan, and found your presentation very interesting. I have been writing for the last 12 years, 15 years, trying to encourage psychiatrists and psychotherapists to get interested in the neuroscience that Carl and company have been developing and spreading about the world. It's not easy to do, is it?
No, not at all.
Most people, if they look at the article, all they see is the math first and then go, no, thanks. And it's like, no, I tell them to look for the verbs and the nouns, and generally they'll understand it. Your presentation made sense. And two things. The one I would encourage you to look for a book, Jim Grigsby, Neurodynamics of Personality. It was written in 1999, and it brought forward attractor networks and all kinds of things that led me into further adventures in neuroscience. And he also caught on to it's always process before content, which is something that I live and learn by. I have residents, and I don't know if someone's knocking on my door as a resident, but one other thing, you said intuitively people know how to change the model to fit the data. I actually think that like people intuitively don't change the model to fit the data. That the prior that creates the model usually has enough history and background that I just don't see it happening in terms of, let's say, maybe it's partly poor models, but when I meet people, they usually stand by their models and they're going to stand by them until we spend a lot of time literally living together and proving that their model doesn't fit me. So when I think about that perceptual inference, I kind of rule it out, but you could surprise me. At least in terms of, I mean, our models of walking, our models of health, possibly, but in terms of illness, there's usually enough energy behind the models that they won't change the model to fit the data. They'll rather change the data to fit the model and do anything else so that their model isn't messed with. So that makes sense.
It does, and I totally agree with you, Patrice. I think that I must have misspoke. What I meant was, I think it's intuitive for us to understand that you could update a model to fit the data, but it's less intuitive to us to think that you could change the data to fit the model. So not that it's easy for us to change our models, but that, you know, we could. I think when I tell people you could change the model you could change the data to fit the model, they're like, it's hard to imagine how that might happen.
Right.
Does that make sense? So I agree with you entirely that, yeah, it's really hard to get people to update their models. And we go through lots of ways in which we invent, say, parameters and this reduction of our cognitive dissonance in order to not update our models, at least in ways that would change them fundamentally.
Yeah, and really the only way to change the data to fit the model is active inference and helping them like slow down enough to shift their attention, to put their attention elsewhere, to use their attention differently. That's a lot of the work, at least in psychotherapy. Medication can do it in different ways, but ultimately psychotherapy would help someone. But thanks and let's be in touch. I'm primarily a psychotherapist, but I'm also a psychiatrist, and I have residents knocking at my door to talk about the patients that they've been seeing. So, but thanks a lot.
Thank you, Patrice. I appreciate you hanging around a little bit. Thank you.
Take care.
You too. Hello.
Hi, Patrick. Thank you so much for this talk. I have a background in cognitive psychology, and then I definitely resonate with your point about how, you know, active inference isn't widely discussed yet, and then sometimes we have to justify its relevance. And even coming from a background in psychology and in cognitive science, where I do meet with a lot of like neuroscientists and psychologists, I sometimes need to explain myself. So I do resonate with that. And it's really nice to see that like the field of computational psychiatry has been increasingly becoming popular. And even though I think it's very promising, even though it may still be a long way off. So regarding to your talk, I do have some questions. So the first one that I've been thinking about is that you mentioned about changing our model, and as Patrice just said, it's very hard to change one's model, and you know, a lot of maladaptive core beliefs in a patient, for example, probably formed from a very traumatic experience or an adverse experience that they had to have that model. They developed that model for the sake of survival, So that really comes down to the core. So as once those models play such a crucial survival role in those abnormal circumstances, for example, from a very early age, in such cases, like would simply increasing that information gain, for example, through CBT to be enough to update the belief? Or from your point of view as a psychiatrist, like what kind of interventions will be actually needed to really update those kind of core beliefs?
Yeah, these are whatever $1 trillion questions, but at the same time, I think they do have answers. And with cognitive behavioral therapy, just thinking about the therapy side of that for a second, there's two ways. It's the hypothetical, so giving people sort of the hypothetical, challenging their model, and for them just to think about it. But and I think in therapy we tend to prefer that because it's easier to do. You can sit in an office, and then you can also do things in an office, things like people here do a lot of EMDR, and like I don't necessarily think the eye movements have much to do with it, but the fact that they're engaging in a sort of ritualistic behavior and trying to concentrate on something else at the same time, that they're also tolerating their distress, and that itself helps. And I think that the hardest thing about CBT is the behavioral things. Like I think that is really the key to getting people to the experiential part of it is the hardest to do, and I think it's the most effective. So if you can get people to experience things that they are predicting are going to be terrible and seeing that they're not, that is more effective in a lot of cases than medication, although medications can dampen down those dampen down the response so that you're not so autonomically aroused. And the combination of the two can have a really good effect too. But I think that what we miss most of the time is the behavioral part, and that's the more powerful. The hypothetical stuff you can do all day, but that tends to just go away over time. You forget that you had that hypothetical thought. But if you're experiencing the world, those are more profound things. In PTSD is a result of experience, right? So you have to counter it with experience.
I totally agree with that. I think that is an amazing point, and that is actually why I really appreciate how the acting inference incorporates action in the loop, because I do think that is the missing piece in just our previous model of like predictive processing. That is a really nice touch to talk about our experiences and updating it. And my next question is, I'm also curious about your view on transdiagnostic approaches. On one of your slides, you actually pull out like different symptoms or pathologies and corresponding them to different levels of expectation gain. But many conditions actually co-occur together. Like for example, bipolar disorder actually have both elements of depression and mania. So I'm curious about your view on this, and how does active inference might differentiate those states and link to a transdiagnostic framework, perhaps?
Yeah, I definitely think that, like, I do think there are underlying common processes that I don't think that any of our diagnoses are just one thing. I guess you could say that. Like our diagnoses are convenient categories that we use in order to try to, when we say this, we understand that someone else is experiencing something that kind of looks like this. So they're experiencing something that looks like depression, but you can have anhedonic depression, or you can have more, like in kids, depression is often super irritable, not, and so you can have different things that we're calling the same thing. So I agree that's difficult. And then, so for a more anhedonic type depression, I think Edmund Rolls also has a model about the orbital frontal cortex where you kind of get stuck in. So the lateral orbital frontal cortex is more about avoiding punishments, and the more medial part is more about getting rewards. And so if you have more of a problem with feeling like everything in life is kind of punishing and nothing is going to result in anything good, then over time that can result in depression. But that's only one way that could happen. And switching between, like, people with bipolar illness, Mixed states are actually way more common than we think. And because we don't really, we see mania and that's easy to identify. We see anhedonic depression and that's easy to identify. But most of the time, these states are more mixed because they're going from one kind of to another. And we miss those states a lot. So I think that we need to be, I think if we think about it in terms of the brain's in some sort of attractor state, it will help us to identify. And if we know enough about what the different parts of the brain could be doing, then we could say, well, it may be over here, or it may be here, or it may be here. So let's try to think about this patient in terms of what is really happening for them and what's most consistent, where is the malfunction most likely happening? And that would help us maybe to choose certain medications, like instead of choosing maybe a serotonergic thing, we might choose a more noradrenergic medication, just right out of the bat. If we have this hypothesis, we're not going to be able to look inside their head, but if we have a better understanding of the possible correlates and how those might relate to behaviors, we might have a better prediction about what medication to start with, or something like that.
Yeah, that makes sense. Thank you so much. Thank you so much for this answer.
You're welcome. Thank you for the question.
Hey, Ryan, I don't know if you can hear me now.
I can hear you, Miguel. Yes.
Oh, nice. Perfect. Okay, now I can thank you for the nice presentation you gave us. Thank you so much. So I just had like a quick question. So I was thinking, if you thought of, is there any literature related to, that relates like mental health to the fact that cognition operates under like limited resources? So you cannot, if you have like a model of the world, that model is going to have some memory limitations. You cannot store, like, you have a limited number of parameters that you could store. Metabolic costs of like sending information throughout this kind of model. And so how is that related to, for instance, some sort of like shortcuts that cognition might take in terms of heuristics and so on, and whether that can lead up to certain like, or how can that be related to certain mental health kind of issues, for instance, as in very fixed prior expectations can be related, to even if you're like presented with data that is not supporting those prior expectations, you are fixed to them, so which shouldn't be ideally happen, right? So if there's like any literature relating specific to heuristics in cognitive limitations or constraints or something like that along those lines.
Yeah, thank you for all those questions. I think really important to think about that. So in psychopathology, I think by definition, the brain is having problem with the allocation of resources. And so it's not like participating in the kind of correlation, anti-correlation that it normally would in order to kind of adjust itself. So the prefrontal cortex, for example, trying to talk to the orbital frontal cortex and saying, hey, you actually completed this in what you're doing right now, you need to update what you're doing. And it can't listen or for some reason is stuck in such a state that the inhibition that is being provided by the prefrontal cortex just isn't getting it out of that state. So there's a problem with resource. One part of the brain's trying to get the other part of the brain to not use as many resources. You could think of it that way. And then, but it continues to pathologically. And there's this metabolic cost. So I think over time, especially for psychiatric, psychotic diseases, in the medial temporal lobes, there's this huge increase usually early on in schizophrenia of activity there, and it kind of burns it out. So over time, the medial cortex shrinks, but in the beginning, it's way overactive, and it's kind of using up resources that it shouldn't be, and potentially burning itself out, you could say. In terms of having like fixed prior expectations that are hard to update, I'm not probably the person who can tell you exactly neurologically why that's happening. It would be, I think, in general, once kids, I work with kids now, and so that it's amazing to see them because they the way they experience the world is far less what we would call reality based. It's far less rigid, and in fact, they can imagine many more possibilities than most adults, I think, can or naturally do. And so we go through this really, that could be seen as super inefficient. Like, why would you do that? Why would you not see reality for what it is? Why would you go around basically hallucinating the world? And as kids, they're doing it poorly, and it requires tons of resources from parents in order to keep them from dying, because they're in this state of non, they're not like an antelope, which is born, hops up, knows exactly what to do basically, and starts doing it. It takes them, well, in our society, like 18 years to get to the point where we'll even let them go out on their own to do it. So it is a super inefficient process, I think. And our brains and humans as species tolerate huge amounts of metabolic costs that really don't, like, if you're thinking about things in terms of the immediate reward of that, it's not obvious. So I don't know if that answers your question, but
no, it was very colorful thinking of this waste of resources, like like putting too much resources in something that's going to result in some inefficiency. Yeah, that's also interesting. Cool. So maybe, Carl, we can move to you now.
Ryan,
or,
did you?
Oh, you're not. Oh.
Yes.
Oh, sorry,
Yes,
Ryan.
Ryan. Thank you. No, thank you, Miguel. Thank you, Ryan. I don't know what's going on from Michigan today, but we have at least. I'm also calling in from Michigan, from the Detroit area. But I want to thank you because it's nice to hear some of the frameworks discussed here tied to clinical correlates. My question focuses more on the preceding Q&A on the degree to which a model can change. So I'm wondering how you're thinking about ways in which we can test, because we know that sometimes you can maybe not change a whole model, but tweak a model, especially people who experience, I'm going to quote back Batman because I'm a Batman fan. What is it? People need dramatic examples to shake them out of their apathy, right?
Mm-hmm.
I'm wondering ways in which you can, sort of as a proof of concept, maybe on a smaller scale, as opposed to completely ridding oneself of a model, have a proof of concept so that you can sort of validate that as a path to pursue research-wise.
Yeah. So how do we get people to maybe tolerate the uncertainty required in order to update a model? Because when I think about the process of model updating, I don't think that you get information and that your brain just changes its model, because especially these built-in, more complex social type interaction models that we have. But I think that in some way that model has to be broken. And then once it's broken, you have to find a new one. And so we hold on to these because that process of change is actually extremely difficult, because you have to tolerate huge amounts of uncertainty for a while and actually gather more data to get there. Like you said, it seems to require a huge input in the beginning, something rather profound, to get us to update our social kinds of, or psychological models once they're formed. As far as how would we test that?
I don't expect you to have a full-on answer from the outset. I was just wondering about how you're thinking about it.
Yeah. Yeah. I mean, the way I test it in clinical practice is I try to see how tolerant any of my patients are to some uncertainty, right? And part of the cognitive behavioral therapy process is to offer them kinds of hypotheses that don't agree with them and see how well they deal with that. And over time you can kind of chip away at things. And if you ask enough questions and then they go home and they're thinking about that question you asked, so it's not a process. I think this is one of the reasons why in psychodynamic therapy, because they keep patients for a very, very long time, certain models related to things like if you're have moderate to mild depressive symptoms, or you're pretty anxious, they can have pretty high effect sizes, because if you have a good therapist, it's a very slow process of chipping away at things. It's not a big process. I've suddenly updated my model. And so it usually requires them going back out into the world, maybe trying something new, trying something a little different than they would have before. And then that helps a little bit for them to gain the confidence to tolerate maybe some of the uncertainty in them doing something else. Does that help?
It does help me understand how you conceptualize it, because I think one of the things is I do come from the world of basic science, neurobiology, and now as a clinician, family medicine. I mean, these are products that I've seen on a very like reduced model, and now in a patient. And then there's the burden of evidence people outside the theoretical neurobiology have as a burdens of proof in order to feel reassured of, we'll say, a theoretical framework. And so it's interesting to, hear Patrice say, I think this, because I think I'm just excited that Carl actually let me sort of eavesdrop on these conversations, because it's helpful to understand where this may be headed, even if, there's a lot of naysaying along. I mean, we're all naysayers to a healthy extent, but to get to where I think that active inference would benefit all of us. So I thank you for your work, and I'm excited to follow it.
Yeah. Thanks for the question. I think right now for me, we need more. Yeah, we need more testing of these things. And I'm not a researcher. I'm more in clinical practice. I don't have time to do that, but I've been thinking about the future, like when I have time to do things like, and one of the questions, I'm asking myself is, how can this be operationalized as in terms of an experiment that can kind of rule out other things, and make the active inference process in the brain more of a something that seems to be what's left for explanatory models. Thank you, Ryan. I appreciate.
No. God bless you for trying, man. I knew it would be a hard question, but I learned a lot just through the dialogue. Thank you so much.
Thank you.
Thank you so much for the question. Just checking, can you still hear me, Ryan?
I can, Miguel.
Okay,
yes.
Okay, cool, thank you. So let's see if there's any other question in the chat. I don't want to miss anyone. So yeah, I guess if not, then we can move to you, Carl.
Right, is it my turn now then?
Yeah, seems so.
Excellent. Good. Well, thank you very much. That was a wonderful presentation and equally brilliant discussion. And I'll say at the outset, I can imagine you're getting quite tired, because we've been going now for an hour and a half, and that's the usual span of attention. So what I normally do now is try to sort of summarize some of the cross-cutting themes, and point to bits of literature which you may know or may not know that might substantiate some of the the points that you've been conveying. In virtue of the fact that everybody might be a bit tired and will have to go off, I'm going to speak quite quickly for the recording, really. So for everybody else here, I appreciate that there may be other meetings you need to go to. But I will certainly hang in here and just rehearse some of the key discussion points and the key points of the presentation for the recording. Obviously I can't summarize everything that you've discussed, so I'll say it again at the outset. I mean, that was an incredibly impressive, comprehensive and inclusive survey of all the different perspectives that one could bring to bear on psychiatric problems, from numerous perspectives, the neurobiology, functional anatomy, cognitive behavioral therapy, attractor dynamics. It was a very, I repeat, inclusive, multimodal kind of treatment. And because it was so inclusive, I repeat, I'm not going to be able to comment upon everything. So what I'm going to do is just drill down on things that stuck in my mind during the presentation and during the question and answer. In one respect, the very last thing you said, I think probably is a nice place to start, which is, take a deep look at the problem and see what's left standing at the end. And in one sense, that is the agenda or the purpose of the free energy principle and its application, namely active inference. So it's not meant to be a new theory. It's meant to be a relatively straightforward approach or principle that you can apply that should easily accommodate all the perspectives that you could adopt. And you gave us a very nice review of those, partially historic, partially referring to the work of people like Edmund Rolls and the like, or behaviorism. So complementary perspectives on the one thing which stands, which should be a relatively simple story that should serve two purposes. One, it's understandable by you and your patients. I think that's quite important. If you can't share the story with them, then very much in the spirit of CBT, then it's probably not going to be sufficiently potent for them to change their mind or to have some sort of metacognitive appreciation of why you're doing what you are doing, if it is, say, CBT or psychoanalysis. So that very observation, I think, licenses your attempt and successful attempt to join a lot of the dots and to show that there are many different perspectives on that one thing. From a critical point of view, I'm wondering it'd be much easier either for a grand round audience or indeed a patient or indeed a colleague to simplify the story and find I repeat, the cross-cutting themes that do the dot joining for you, simply because you'll be able to communicate it more quickly. In that spirit, there were a couple of foundations or pillars to the argument which kept reappearing, which I think are very useful vehicles that would enable you to tell a streamlined story. One was clearly the focus on attractors, and the other was variously referred to in terms of attention. At one point, you highlighted the crucial ability to ignore. You talked about gain. You talked about uncertainty. You talked about precision. All of these things under active inference can be all lumped together, I think, in a potentially useful way. And that would speak to the second thing you'd like your narrative to be able to do. So not only should it make sense, should it have some kind of face validity in communicating to colleagues and patients, but also it does foreground the way forward for mechanistic research and inquiry. And it's so one aim of the particular papers and ideas that I'm going to feed back to you or reflect to you is a common focus on the mechanisms that mediate attention, uncertainty, whether we're stuck in a rut, whether we have the ability to escape our deep attractors, and so on and so forth. Simply because that has not just a belief-based or psychological or a narrative aspect, but it also identifies the particular biophysical mechanism, neurochemical mechanisms that you could start to think of in terms of biological psychiatry and pharmacotherapy as an adjunct for or in addition to the more psychological inference, intention-based, motivation-based accounts. One of the questions, Sylvia questions about, I felt that was quite interesting. Sylvia, you were saying that you like active inference because it goes beyond predictive processing. I smiled at that, largely because I know where predictive processing came from. So it was Andy Clark who introduced that in his seminal BBS paper. And the reason he didn't use predictive coding, which was the flavor of the month at the time that he wrote that, was that he didn't want to commit to predictive coding. He wanted to actually implicitly include action of an overt sort, or possibly an attentional covert sort, in this notion of the predictive brain, the sense-making brain that is also making decisions and acting under uncertainty. So from my point of view, I always read predictive processing as active inference, but clearly there's a generation of people out there that see the active inference as being slightly more explicitly committed to embodiment and inactivism, and that may be the case. But I did think that was interesting. Again, general points, and also I think Silva was making this point that she was thought that there was a lot of work to do. In fact, Patrice was also making that point, and indeed, Ryan, you made it. There is a lot of heavy lifting ahead in terms of alerting people to the potential of these of a predictive processing or active inference account of psychopathology. In some fields, that a lot of that heavy lifting has already been done, and I'm very mindful of the neuropsychoanalysis movement, where I think you would find a lot of friends and a lot of immediate appreciation and understanding, simply because they've been thinking about along these lines for many years. Particularly under the guidance of a chap called Mark Soames. Are you familiar with Mark Soames?
Yeah, I'm familiar with Mark. I read Hidden Spring, and then I've listened to him give many different talks, as many as I could find, online or on different podcasts. And I even joined I paid for a subscription to neuropsychoanalysis so that I can get more stuff fed to me, because I know that a lot of those papers, and you have published in those as well, try to incorporate an active inference framework. I haven't reached out to Mark like directly or anything, and I'm not like an active member of the society, but I'm aware of them. Yeah.
Oh, good. Okay, excellent. Yeah. What I'm going to do is I'm going to share my screen, because you may respond like that to a lot of my suggestions. Yes, I knew about that, so I don't want to waste your time. So I actually had the. So if you'll excuse me, I'll now share my screen and just go through a whole series of papers. I'm afraid they're very self-referential, because that is the work that I know, but they all make a point which I thought would engage you or entertain you. I would imagine at least half you'll already know about, so I'll just skip over those, or I'll just mention why I'm showing them. But there may be a few in there that you haven't come across that you might find useful background reading, and or as an opportunity to, I repeat, sort of close the gap or join the dots between the different ways of articulating things, specifically this link between attention, mental action, gain, precision, uncertainty, and its mediation through classical neurotransmitters such as dopamine, serotonin, adrenaline, and the like. So let me just, if I may, this is going to, I repeat, be a stream of consciousness, because I've got to get it all on the recording in the next 20 minutes. So please forgive me. So let's go for window, screen. Good. So hopefully you'll be able to see this. Right. So for everybody else, Ryan already being a member of the, so this is the splash page for the neuropsychoanalysis movement that was largely set up by Mark Soames and Pangskep, who was one of the good and greats of the sort of different kinds of affective behaviour, and together it has flourished into an international community that would, I repeat, have a very sympathetic understanding of the the initiatives and the endeavours that we've been talking about. What else? Yeah. This is the work of Ralph Hoffman. Ralph, have you come across his work?
I don't think Hoffman does not sound familiar to me.
Okay, this is going to be a little bit historical, so I suspect it's going to be largely just, I repeat, sort of background reading with a possible nod to a particular notion that he brought to the table, which is the notion of parasitic attractors. So Ralph Hoffman, he passed several years ago, but used to work at Yale, same place as Nancy Andreasen and John Christo, I think, is the current head of psychiatry there, along with colleagues like Phil Corlett and Al Powers, who've done quite a lot of work on hallucinosis and its sort of predictive processing, active inference basis that speaks to this sort of precision-based account of sense making. But his background and his contribution was reflected, I think, your focus on the importance of understanding self-organization, neuronal dynamics in terms of attractors and the different kinds of attractors. And it did strike me that the notion of a parasitic attractor that has kept you in place was something which was quite pertinent to certainly some of the graphics. And I should say your AI graphics are brilliant, so that was very impressive. In modern day parlance, those parasitic attractors, or getting stuck in a local attractor that may be suboptimal and may be high in a landscape from which you cannot escape to a lower, more would be lower attractor state, would be read literally as attractors on a free energy landscape. So this is a bit technical. You'll never find yourself in a position of having to explain this to your clinical colleagues. But from the maths of active inference, and specifically, more generally, the free energy principle, everything can be described in terms of the process. Just to reflect your dialogue with Patrice, it's all about the process. Everything can be described, and by thing, I mean anything with a Markov blanket, can be described as navigating or flowing on a free energy landscape. And you are pursuing minima on that landscape. The minima are always moving, so you're never, you're like, as Andy Clark would say, surfing uncertainty. You're surfing a wave as it chases the minima around. So we're always on the move, a little bit like a shark. But still, I think the notion of an attractor still holds. Crucially, 2 points about this: the flow on this attractor landscape, or this free energy landscape that defines the attractors, the wells that you were presenting in the graphics, is just a gradient flow on the free energy. So everything can be described as trying to minimize its free energy by flowing down free energy landscapes. And because the negative of free energy is a bound on log evidence, that's exactly the same as flowing up a landscape of evidence, and hence your phrase self-evidencing. So that's just the physics of self-organization of any system that can be described as something that can be separated, or a self that can be separated from non-self. The other important thing about these attractors and the landscape in which they exist is that the support, the x-axis that you are drawing, is something called a statistical, it's a statistical manifold, or more specifically the landscape, like a Waddington landscape in evolutionary theory, is the manifold. But its support, the range over which that landscape exists, is a very special one, where every point on the x-axis corresponds to a belief. A belief in the Bayesian sense is a conditional probability distribution. So as you move around on the x-axis, you are literally changing your mind. If you will equate the encoding of your posterior beliefs or probability distributions about the causes of your sensations, if you call these beliefs of a technical sort, Bayesian beliefs in the sense of Bayesian belief propagation. The interesting thing is that when you move on this free energy landscape or statistical manifold, that means because you are necessarily moving along the x-axis, you are literally changing your mind. And this is called Bayesian belief updating. So the process of inference or Bayesian belief updating just is flowing down the gradients of variation free energy towards attractors. And a third important aspect of this construct, which is universal and happily accommodates the notion of parasitic attractors, for example, is that the tendency to get stuck in a particular attractor depends upon how sharp it is. And how sharp it is corresponds to the precision of the way in which your beliefs are held. So that if you're a very, very sharp minima from which it's very, very difficult to escape, then a small movement in your beliefs is going to incur a high free energy cost, which means you are effectively trapped in this canal, in this ravine, in this rut, simply because you hold these beliefs with too much precision. And I think this is exactly what you're referring to in terms of difficult to escape high free energy attractors. That people get stuck, and I think that's probably the basis of that slight disagreement between you and Patrice about, it's easy to change your mind, to make the world fit, and she was saying, oh no, it's not. And I think for some people it is very easy if they've got the latitude to do that, literally by relaxing the precision and making what was a very, very sharp attractor now much more shallow so that they can escape it. So from the point of view of the narrative based upon attractors, which I thought was compelling, then the precision or the sharpness of these attractors is one of the key factors that underwrites whether you can escape these attractors or explore other attractors, other ways of being, other ways of mentalizing your situation or making sense or reducing cognitive dissonance, however you want to frame it. All that rests on being able to relax the precision of these attractors by becoming, in your belief space, more accommodating, more uncertain. In fact, mathematically, that's just Occam's principle. If you're a physicist, it would be known as James's maximum entropy principle, because that sharpness is also the negative entropy. So the maximum entropy principle just means that self-organizing systems should naturally have a maximum entropy, which means a maximum escapability, so that you can actually change your mind. So what controls the precision now, I think, has a key role in determining whether you can change your mind, or indeed whether you offer the opportunity for a patient to change her mind. And that's going to be the second theme that I want to pursue. One way of, so that was Ralph Hoffman. One way of articulating that is the way that Robin Carhart Harris articulates. Again, I'm assuming you know him. If you don't, then he's written in a quite wide-ranging way about one particular device that one can use to relax the sharpness of the attractors by relaxing the precision or increasing the entropy in the right kind of way. So you don't have to do it by changing your intentional set, or by meditation, or by cognitive behavior therapy, or putting hypotheses, other ways of doing things to the patient in the way you were describing in the outpatient clinic. You can do it with pharmacology. So the encoding of the sharpness of the attractors corresponds to the precision in a predictive coding formulation that you assign your prediction errors. And the way that that is encoded is thought to be in terms of the excitation inhibition balance, or the excitability of neurons that encode prediction errors. So if they're very excitable and very sensitive, as soon as you change your mind, they broadcast and elicit belief updating, revising your posterior beliefs at somewhere else in your hierarchy or your small world network. So the excitability, or the gain, to use your word, which is just the same as the neuromodulator gain of the induced by things like dopamine. In fact, all the classical neurotransmitter systems operate on this with this kind of gain control, cortical gain control, that reset the excitation inhibition balance, and the excitability of neurons broadcast into other neurons change your mind. So that means that the precision, the sharpness of the landscape is determined by the synaptic gain or sensitivity that can be read functionally in terms of the encoding of the precision or the inverse uncertainty. So precision is confidence, whereas the complement would be a flat, so good kind of uncertainty, a bit of latitude to the explanations you bring to the table to explain the sensorium. So that means that you should, in principle, be able to modulate the gain and relax the precision, increase the curvature of these minima by acting upon the same receptors that the classical modulation neurotransmitter systems act on. One beautiful example is 5-HT2A, serotonin 2A subtype receptors, which of course are the things like psilocybin and other psychedelics are partial agonists at these kinds of receptors, and through a disinhibitionary inhibition effect, they effectively can relax the priors at the top of these small world or scale-free hierarchical networks, thereby making the lower, relatively speaking, making the lower belief updating and message passing and predictive coding more precise, effectively turning attention away from your prior constructs towards more sensory elemental constructs. So I can't remember what the acronym actually stands for, but it basically, for me, it reads a relaxation of the precision of these very high level beliefs about either what I'm going to do, and people think that dopamine encodes the precision of beliefs about what I'm going to do, or the latent states of affairs that I have inferred that are causing my sensations. So it can be, sort of perceptual precision. Interestingly, the perceptual precision breaks into two kinds. It can be about state transitions, dynamics, paths, narratives into the future, in terms of the sort of latent causes, abstract causes of the sensorium, or the likelihood mapping to the sensorium. And there's some nice work in the theoretical biology literature assigning different neurotransmitters to these different kinds of precision. So if I've got very, very precise beliefs about the future, I can roll out a long way and make a very informed decision. If I've got very imprecise beliefs, then I can't roll out very far, and I may be very impulsive, I may be quite manic, I may be giving my telephone number or my bank account to that naughty real estate chap from Florida, simply because I've got my encoding of uncertainty in a certain part of my world model, my generative model, wrong. And thereby that has a profound influence on what am I going to do, and subsequent behavior and subsequent action. So I thought this might be useful if you don't know his work, because it provides, I think, a really nice link between the psychopharmacology and the psychology that fits very beautifully with this trying to get out of these parasitic attractors that can be literally regarded as being stuck in a rut. So you talked about depression and other psychopathologies, of say OCD, that can very easily be construed as this is the way that I behave, and I behave like this because I, with great precision and confidence, believe that if I do that, something awful will happen. Therefore, I don't do that. Therefore, I never afford the opportunity to get some evidence to revise my very precise beliefs. So it's a sort of vicious cycle, which is self-maintaining, simply because I now, and to use your phrase, you talked about the expected information gain, I now, these particular, if you like, almost, yes, parasitic perhaps, but sort of certainly autopoietic, precise beliefs stop me gathering evidence that these precise beliefs should not be held with such precision. So that there's a sort of circular pathology going on here that precludes any other way of doing things, which I guess relates to what you were talking about, the various ways that you would intervene, either through cognitive behavior therapy, through acting. So say, well, why don't you actually do that and see what happens? Get some new evidence and then update your beliefs simply because you've undermined or relaxed your prior belief that this is the way, this is what would happen if I did that, or if I went out, or I didn't wash my hands 6 times, or whatever. So that's the rebus perspective. Robin has written a lot, a lot around this, the neurochemistry and the sort of the basic neuroscience. Is also taking it in a direction of sort of a generalized psychopathology in terms of canalization on these free energy landscapes that you might be interested in, but you can pursue that should you want to at your leisure. I put this paper here simply because it provides a mathematical backstory for the absolute importance of this precision, which is, just an attribute of any particular belief. Inverse precision is variance, for example. So, any probability distribution or any Bayesian belief just has 2 characteristics. One, it's the content, the location parameter. I believe my X is over here somewhere. And then 2, it's the dispersion, or the variance, or the inverse variance, which is the precision, the concentration, the confidence, the reliability. Put another way, to have a belief and to change your mind and do belief updating and to be, to evince a process of inference and sense making, simply is to have a probabilistic structure that has 2 aspects: what the content, which is where it is, and the uncertainty or the precision, inverse uncertainty, that is quantified by the spread or the dispersion or the variance. So when you talked about uncertainty, I heard inverse precision. And when you talked about attention, I heard changing the precision. I didn't mention that before, but if you're a psychologist, increasing or decreasing the gain, i.e. the precision, for example, of prediction errors at this point in some small world hierarchy, basically is the same as attending to those messages that are emanating from this now very precise, hyper-excitable, say, population of prediction errors. If I want to ignore something, I will just attenuate the precision, and thereby effectively dampen or preclude those prediction errors from updating my beliefs elsewhere. That's really, when you talked about the ability to ignore, I think, about the 6th or 8th slide, I thought it was really important. And, our ability to ignore underwrites our ability to move. And of course, you can now appeal to sensory attenuation and things like saccadic suppression during eye movements as a necessary part of moving. Because if I didn't ignore all the evidence from my proprioception and my somatosensation that I wasn't moving, then if I have this prior intention to move, I'm immediately going to change my mind because all the evidence is saying, no, you're not moving. So I'd have Parkinson's disease or I would be catatonic. So what I have to do is to ignore the fact I'm not moving in order to initiate a movement. To do that, I have to attenuate the precision. So not only do I selectively attend to this or attend to that by increasing the precision using these classical neuromodulatory transmitter systems and everything else they induce, but also I have to carefully attenuate 99% of all the information that I have to ignore in order to act, or, as you would put it, to shape the sensed world in a way that accords with my prior beliefs, because I don't actually have to look away. So say I'm watching a film and there's such a gory bit coming that I actually literally move to stop myself seeing that. But I can do that on the inside just by doing sensory attenuation. I can literally sort of, block that and ignore that in the right kind of way to make sure that what I do sense, the evidence at hand I do have, is completely consistent with my understanding of the way that the world unfolds and that things happen. But if you lose the ability for this sensory attenuation or selective attention, imagine the horrors if you can't ignore. And of course, that's the story, certainly the Bayesian brain or predictive processing or active inference story for autism. And what this paper shows is it might be apt also for schizophrenia. because coming to your treatment of hallucinations, then the way you described it was that there was unignorable sensory stimulation, sensory impressions that you couldn't ignore. Therefore, you had to make sense of them, and sometimes you get the wrong conclusion, and or the wrong posterior belief. And of course, the inability to ignore all these sensory fluctuations, which you would normally ignore, it just is a failure of sensory attenuation. It's a failure of this precision, a failure of selective attention, in the inverse. So this paper by Rick Adams, actually, again, this is not something you would share with your colleagues, but it might be interesting background reading for you because it simulates a predictive coding scheme to simulate hallucinosis simply by fiddling with or simulating aberrant precision control or attentional gain, or postsynaptic sensitivity or excitation inhibition balance, which is popular in schizophrenia research at the moment. Interestingly, I haven't got any papers here, but Rick Adams then also went on to study slow pursuit eye movements in schizophrenia, and is currently working on electrophysiological studies to actually try and quantify the mechanisms of this failure of gain control that mediates the precision or the sharpness of these potentially pathological attractors, where you do get stuck in these either perceptual or other kinds of ruts. I just put this up just to endorse this your observation that we sometimes construe the world in a way that we believe it should be, as opposed to the way it actually is. And of course, if you've got these mechanisms to ignore this kind of evidence and not ignore that kind of evidence, that is entirely the Bayes optimal way to get through your life. So if you can ignore all the evidence that you're not getting through your life, then by definition, and you're still alive, you're doing a good job. So I put this paper up because it was written by people well outside the theoretical space. There was basically cognitive scientists who were very much interested in wishful thinking and motivated thinking from a psychological perspective, but their formulation read very easily from the technical point of view of active inference, and effectively just offers a bilateral account of why it is entirely Bayes optimal not to open the letter that will tell you whether you've got cancer or not, if you believe you're not the kind of person that gets cancer. That it is entirely Bayes optimal to have this optimism bias when you are in charge of the evidence that you can select to build your models and understanding of your world. So I thought you might enjoy this. It is a bit narrative biased, but it does talk about motivations and risk and ambiguity, very much in the spirit that you were talking about. So I thought you might enjoy that. This is another treatment of attractors, and I bring this to the table. I'm going about this the wrong way. Let me just sort of come back and just give you a couple of examples where that spoke to some of the themes you were discussing, that rest upon not necessarily the content of your beliefs, but the relative precision with which alternative beliefs or hypotheses are held, and that much of psychopathology can be understood in terms of this second order representation. It's basically the confidence or the certainty or the precision you assign to certain beliefs, certainly in a hierarchical setting, that can explain a lot of psychopathology. This isn't a particularly good example, but it was it was written by, the senior author was Paul Badcock, who has done some very nice work, who's a adolescent, I think, psychologist in Melbourne, and he was working with other colleagues here just to look at the Bayes optimality of certain behaviors, including depressive behaviors, and how you could understand this as a selective filtering or assigning precision to certain outcomes and certain parts of your world model. There are other accounts that rest upon more explicitly precision, but I thought this was an interesting one from your point of view. In relation to Miguel's question about sort of metabolic efficiency and the resource allocation, which I read basically as the natural pressure to minimize the complexity or the degrees of freedom that you use to provide explanations of your lived world, statistically speaking, the complexity of the models, then one important aspect of that also entails the encoding of uncertainty or precision. And this was a sort of, when I say this, this was a treatment primarily by Achim Peters, but usefully informed by Bruce McEwen, who was one of the good and great of allostatic load and chronic stress and wear psychologically on metabolism and thermodynamics and metabolics of the system. So this is so half for Miguel, but half for you, as another instance of a certain kind of, or a certain perspective on psychopathology. In this instance, chronic stress and anxiety that rests upon and only upon the estimation of the right kinds of precision or uncertainty that you would bring to the table in order to make sense of your world and changes in circumstances in your world. And it goes into great detail in terms of the underlying neuroendocrinology and the metabolic consequences and how it relates to predictive processing generally. So that may or may not be interesting. Oh, yeah, and then this is my review from a couple of years ago that has a very particular focus on precision in its various expressions in various neurological and psychiatric psychiatric conditions. This is a review, and I'm putting this up not just to be self-promoting, but because it's got, I think, over 200 references. Oh yes, there we go. That will, substantiate many of the points you are making, but also, I think, provide an opportunity again to join the dots. That many people are talking about the same thing, just using a different kind of semantics and a slightly different perspective, but they're all effectively talking about the same thing. And the thing in this instance was indeed the precision read in a very distinct sense from precision psychiatry or precision medicine. This is literally very precisely the precision of your attractors or your beliefs. I put this up just for entertainment because I love that rubber hand illusion. I hadn't seen that video before. It was brilliant, and it really does, in a few seconds, if not minutes, bring active inference, into intuitive insight. And this gentleman here, Jakob Libnowski, who's currently in Germany, who's a close colleague of mine, actually studied related phenomena using electrophysiology and computational modeling. This is a computational modeling study under active inference, just looking at this sort of these really powerful illusions and how they rest upon precision that you assign to this hypothesis or that hypothesis, or in order to try and make sense, the simplest sense of your extraceptive, say, looking at the hand, whilst ignoring the proprioceptive, where I feel my hand is positioned, in order to get a simple story for everything I am sensing. And in order to do the right kind of ignoring and to attend to the visual cues that the participants in your video were enjoying, one has to be able to tune the precision or the gain or the attention to these various sources of information. And Jakob has written quite beautifully about that from the point of view of what it means when thinking about this deployment of precision or gain or confidence on the inside without actually moving. So you can think of this as basically either in terms of attention, but in relation to things like the premotor theory of attention, you can think of the deployment of attention as action on the inside. So it's not quite the same kind of embodied action that Sylvia was celebrating, but it's still action. It's a really important action. I haven't read this for a long time, but certainly one aspect of self-evidencing is to get the precision right by attenuating and ignoring the right stuff. So Jakob talked about this in terms of attenuating oneself, which is one way of mechanistically writing down something in the Bayesian mechanics, this notion of the importance of ignoring, and particularly ignoring sources at ignoring the right kind of interoceptional sources of evidence from your own body. So this might link in nicely with some of your ignoring stuff. You didn't mention very much interoception. Exactly the same arguments can be sort of unpacked from a sort of either James Lang or sort of Tony Damasio or Lisa Feldman Barrett or a Neil Seth perspective, where again the focus is basically on what do I attend to by assigning it the right precision or otherwise, where the specific focus is on interoception, gut signal, literally gut feelings, and feelings read either as hypotheses about the state of emotional state of mind I am in at the moment, or sensory impressions that have to be explained by the fact I am feeling like this at the moment. I feel my heart racing, therefore I must be anxious, which means that I'm going to predict I'm going to racing heart, and you get these sort of virtual or vicious circles of James Langian kind that underwrite this process of belief updating, where the source of evidence is your own body, and you have to explain why is your body sending you these signals, or perhaps I'm a thing, and perhaps I'm a thing that's anxious or embarrassed or in love or whatever. All of these things have to be recognized in order to do the mental action to predict the right precisions, to contextualize your message passing on these hierarchical or small world networks. The small world aspect is interesting. And I think you're probably using it, and indeed your graphics spoke to this explicitly, to emphasize the scale-free aspect of the principles that you're talking about. Just for your interest, this is hit home in machine learning and artificial consciousness research, and this is a recent paper that I was a lead author on. It's got nothing to do with psychiatry. It's all about playing Atari games ultimately. But the main point is, if you really commit to a scale-free architecture for your world models, you can get a long way. And it's very likely that that's exactly what the brain is doing. So using sort of scale-free principles to reproduce through a series of coarse grainings exactly the same belief updating principles and message passing, but are increasingly abstracted and coarse-grained representations of our narratives and passage through the world, and the latent states that are thus entailed. You don't read this. I'm just you can speed read the abstract at some point, but it's just to say that if you mention scale-free in a paper or a review, you can say, not only is this a hallmark of biotic architectures and self-organization, it is also finding purchase in machine learning. And there are some references here that you can use as documentary evidence that is the case. What's this one about? Oh yes, this was one aspect of this sort of scale-free approach that you were talking about, and working your way to effectively sort of Markov blankets within Markov blankets. And has been has been pursued at a very abstract level by an author called Chris Fields, who was a friend of Jim Glazebrook and Mike Levin. You may have come across Mike Levin as a sort of quite a prominent theorist in theoretical biology and cell biology. Chris Fields himself is more of a physicist and a theoretician of an abstract, a mathematical sort, but he certainly has, with Mike and Jim, written a series of papers, again, emphasizing the scale-free aspect of any system that manages to navigate or negotiate a capricious world, and more recently has taken those ideas and looked at through the lens of one version of active inference, is looked at consciousness, and the idea being that in this successive scale-free coarse graining of our representations of our at least sensed world, and possibly ourselves in the sensed world, there may be in the center the one privileged hub, to use your nomenclature, that cannot be further reduced, in the sense that you don't have any further Markov blankets. Chris Fields reads a Markov blanket as a holographic screen because he likes quantum information theory, but effectively you can think of them the same thing. Everything you need to know about this thing, this self, is written on its Markov blanket or its holographic screen. That's all you have access to. And it may be that there's one privileged or unique, or possibly more than one, inner screen, in a holographic screen, or in a Markov blanket that doesn't have any more Markov blankets inside it. And the argument here is that the only way that this Markov blanket can know itself is through its mental actions via attention and the like on the Markov blankets that surround it, its world, as it were. So what we're doing now is moving right into consciousness research of a very high end that inherits from the sort of scale-free aspect, but also to a certain extent from the kind of functional architectures that emerge when you apply a scale-free perspective to the structure of generative models defined by the conditional independences and by their Markov blankets. So I thought that might be entertaining for you. Well, I should have put this up first. This is a very early paper that would, I think, gracefully, should you want to, motivate a discussion of active inference as an application of the free energy principle through the language of attractors and through the language of what is valuable. What are the kind of characteristic states do I value given the kind of thing I am? This is just the pullback attractor. How do I explain the existence of these pullback attractors? And that's where the free energy principle comes from. And then an application that is active inference. So there's a deep physics backstory that actually can start with the notion of value and attractors. So this was an early paper with, again, Chinese-American theoretician Ping Hao, who has done some lovely work in the maths of theoretical biology. He has an interest in cancer and evolution, but the same sort of maths underlie both those things. Yeah, and that's the same thing. That was just like me trying to find it. Yeah, and this was the paper that I said, oh, we'll come back to that. So that's quite good. And that's the last paper, excellent. And this is a more modern day equivalent of that earlier attractor description, where it just sort of shows why these attractors have to exist and why you can write down these free energy landscapes on that define these attractors, in the sense that we must, by just existing, have an attracting set of an itinerant sort, known technically as the pullback attractor. And all active inference is effectively saying is we have to basically continually climb the gradients of log evidence in order to resist the dispersions away from our characteristic or attracting sets or our attractor. And of course, that self-evidencing is just the negative of these gradient flows on free energy, bringing us back to the sort of sharp ruts and valleys and minima that you were illustrating. This particular paper leverages that construct again and goes off into hyperspace and talks about consciousness, simply because these special free energy landscapes that have the attracting sets within them, or the attractors within them, live in the space of Bayesian beliefs, which means that you can either talk about the thermodynamics of your brain in terms of information theory, or you can talk about the information about the outside that is entailed by having these beliefs. So the probability distributions are about something else. It's not the probability distribution of neural activity. It is the probability distribution over some attribute of inferred state of affairs in the world that is encoded or parameterized by the neural activity. And this leads to two different kinds of information geometries, which you could read as a way of resolving or dissolving Cartesian duality. Good, we've done that. That wasn't too bad. Oh, yes, it was. Yes, it's now nearly. Oh God, right. Sorry about that.
No, it's okay, Carl. I really appreciate it. Like I have a lot of work to do, and just being able to be here and to do this is it inspires me to keep moving forward, to do more.
Yeah, I noticed you had a pause, so I suspect you had another set of slides. Can I recommend you come back to do the second set of slides where we've had a chance
right,
to recover from today?
To make it fit, I cut down, I think, from 150 slides to like 90 or something like that. So
right, okay.
Yeah, and so yeah, I could come back with some like part 2 if you want, Carl. That'd be great.
Well, you'd be most welcome to, yeah, and certainly if you wanted to move into therapeutics and the like. But I'll give you a nice rule of it, some boundaries. You can't use more than 40 slides, else you're going to exhaust us. All right, so pick your point and then entertain us with those 40 slides.
Sounds good. 40 slides. Thank you for that boundary. All right.
So what happens now is that
thank you so
oh
much.
yes, here he is. Going to make us clap now, isn't he?
Yeah, so thank you so much, Carl and Ryan, for the presentations. Yeah, so let's give a round of applause for Ryan.
Thank you.
And thank you everyone for your questions and discussions as well. So I guess see you everyone next time.